Good afternoon, Rebecca.
Hi, so nice to be here.
So grateful that you're here. Thank you so much for joining me today on Michelle's Conversations That Matter.
Yeah, of course.
I am thrilled that I got to hear you speak recently at the One Mind at Work event in September, and I was really impressed with you and so super educated after hearing you speak about eating disorders. And I was thrilled that you said yes to joining me. So we're going to talk and help our audience understand eating disorders better. I feel like it's a topic I haven't yet discussed or had on my series. So I'm really grateful that I actually have the chief executive officer with Project Heal with me today. So awesome. Before we dive in and talk about this important topic, just a little bit about my series. I created Michelle's Conversations That Matter to elevate the conversation around mental health and create more understanding about different types of mental illnesses and really do my part to help to remove stigma by educating people about different scenarios and hearing from people with lived experience and clinicians alike. What I do professionally is I get to work with organizations to help recenter their people, with about 42% of the global workforce struggling with a decline in their well-being since the beginning of the pandemic. Now more than ever, we have to do more to recenter people and preserve their well-being, and that's what I get to do when I work with corporations to deliver resilience and leader workshops. So, without further ado, if you wouldn't mind, could you please introduce yourself, Rebecca, who you are, where you live, what you do for a living, and have us get to know you a little bit?
Sure. My name is Rebecca Eyre. My pronouns are she, her. I live in Brooklyn, New York. I am the CEO of Project Heal. We're a national nonprofit focused on equitable eating disorder treatment access. Our mission is to break down systemic healthcare and financial barriers to eating disorder treatment. I'm actually a therapist by trade. I've been treating eating disorders for 10 years. I'm very passionate about this work for a lot of reasons I'm sure we'll get into. And in terms of who I am personally, I love dogs and food and karaoke, crosswords, sleeping in. Um,
That's awesome.
lots of I really like to fill my life with things that bring me joy, on top of the other things that I do at work, which, are definitely more of a heavy topic. So
Yeah. Did you grow up in New York?
I didn't. Was born in Baltimore, and then I lived in Colorado and California, and my family lives in Seattle now, and I spent most of my kind of late childhood and early adulthood in Seattle. So I kind of call myself a Seattleite.
That's
But
awesome.
ever since I've been in New York since 2016, and I don't think I'm going to go back. I love this city. So
That's awesome. That's good.
yeah.
It's good.
Yeah.
Tell us a little bit about your backstory. Like, how did you come to be part of Project Heal? You said you were a therapist by training, so tell us a little bit about that backstory.
Yeah, of course. I started working with eating disorders in my internship in my master's program. And I was actually really reluctant to work with eating disorders because my mother had an eating disorder and my sister struggled. And I had various friends with eating disorders. And at that time, I had never met anyone who had recovered from an eating disorder. I had only been around people for whom the eating disorder kind of consumed their life and made them kind of tricky to be close with. And so I knew that I understood eating disorders, but I was reluctant to work with them because I thought it would be too activating for me. But then once I started working with people who had eating disorders and were in treatment, that key difference being that they had decided that they wanted to pursue recovery, and I didn't realize it at the time, but had access to that resource. Working with people who were in the healing process changed everything for me. And I think it was very healing for me to be around people who were trying to recover and to help them get there. So I worked with eating disorders for, many years as a clinician. I worked in an admissions department at an eating disorder treatment center, and I became very familiar over time with the many barriers that exist to helping people get into care. Essentially, a lot of insurance companies not being accepted, people being turned away or unfairly denied by their insurance or prematurely discharged. And so over time, I got really, really passionate about the ways in which the existing treatment setting and context and field is failing. And so a friend of mine was applying to this program director job at Project Heal back in 2019. And they were saying that I should apply for the role too. And I was like, I'm not going to compete with you for this job. Anyway, she ended up not getting the role. And in her reply to the kind of, we're sorry you didn't get this job email, she actually copied me and said, you have to interview Rebecca. She was made for this job. So very kind of random. I wasn't looking for a new job at the time, but I have to agree with my friend that this role was really perfect for me. And then I was in that role for about 1.5 years. And then at the beginning of the pandemic, a lot of things changed, and I was approached by the board and asked if I wanted to be the CEO. So flash forward 1.5 years, maybe 1 year and 7 months, I've been the CEO of Project Heal, and it's been honestly like the job of my lifetime. I can't believe how lucky I am that I get to do something that I care this much about. And it's really like a strange culmination of so many different chapters of my career. My resume is a total mess, but it's perfect for this job. And so, but probably no other jobs. So it feels very like meant to be.
Tell us about Project Heal. Like, what do you do? How do you support the community? How do you help people?
Yeah. So we operate nationally, and we are helping people in the United States access eating disorder treatment. We were founded in 2008 by 2 teenagers who met in treatment and realized how many people weren't represented there and who couldn't access the care or whose insurance kicked them out early. And so they decided to fundraise to help people pay for treatment. And oftentimes nonprofits that are started by teenagers don't, make it and become leading national nonprofits. But Project Heal was a much needed organization, and we've grown and evolved over time to really maximize our impact. We help people with free treatment placements, cash assistance, and insurance navigation, trying to figure out how to get their insurance to cover it or to access free treatment that their insurance won't cover and that they absolutely need and deserve.
Educate us a little bit, Rebecca, on how is an eating disorder a mental illness?
Well, it's in the Diagnostic and Statistical Manual, which is the book that the American Psychiatric Association publishes with all of the diagnostic codes. So it's in the DSM for good cause. Eating disorders are the second most fatal mental illness. There's a lot of misconceptions about the diagnoses themselves because it's a really broad spectrum of diagnoses and a broad spectrum of behaviors, but they ultimately culminate oftentimes in a lot of medical complications. And so the medical piece of eating disorders, I think, confuses people, and it kind of falls through the cracks, both in the psychology field and in the medical field. I think that a lot of times people with medical training never receive training in eating disorders, and a lot of therapists don't receive training with eating disorders because it's sort of too medically serious. And so this, huge population of people, at least 1 in 10 Americans that we know of, are diagnosed with an eating disorder in their lifetime, end up kind of being considered too complicated by both sides because it's this weird interplay of the way that behaviors and thoughts are playing out in the body, oftentimes with really grave consequences. So eating disorders primarily, though, are characterized by behaviors and thought patterns. They're measurable by the amount of distress that they cause in a person's life, and oftentimes by the implications for their health, mental and physical.
Wow.
Yeah.
Well, what are some of the biggest misunderstandings about eating disorders? We talked a little bit about this before we came live. And the other piece of this is, can you educate us on some of these false stereotypes and harmful stigmas associated with the illness?
Yes. I will try to keep it brief, but I could talk about this for a long time. And, a lot of this learning I learned through being in this field. I had a lot of these misconceptions at the beginning too. I mean, I, have this body and look this way, and I fit the stereotype of people who have eating disorders. And those people I mentioned at the beginning, my mother and my sister, fit that stereotype as well. But a lot of those stereotypes are just false. So I think a lot of people have a preconception that eating disorders are sort of like like a rich white teenage girl problem, that they're a vanity issue. And it sort of should be something that someone can change. It's almost like they are perceived as a choice, and every single layer of that is false, right? And I'll take it part by part. People, eating disorders affect people across socioeconomic statuses. The lack of diagnosis in lower socioeconomic status folks has everything to do with access to quality mental health care and just quality healthcare in general. So the fact that those folks aren't getting treatment and aren't, becoming eating disorder advocates and are oftentimes completely missed is actually a fault of the healthcare system, and not a fact that they don't exist, right? So there's that issue. Racially, they actually affect people across races, and there's a couple diagnoses, including bulimia and binge eating disorder, that are more common in Black and Latina women. So racially, it's actually not only not equal, it's actually disproportionately affecting people of color in certain cases. Gender-wise, eating disorders affect people across genders. Trans and non-binary people are actually way more likely to struggle with an eating disorder than their cisgender counterparts. And 25 to 40% of people with eating disorders are men or boys. So it's also not a woman's issue exclusively. And the vanity piece is really, really harmful. If this was just about looking good, then eating disorders simply would not play out the way that they do. There's absolutely body dysmorphia and a sort of a preoccupation with appearance in some of the diagnoses, but definitely not all. And in fact, there are some diagnoses that have absolutely no body image component at all, and they're more about sensory processing or about kind of behavior regulation and or a response to trauma and a response to kind of how a person might try to regulate their own emotions or cope with distress and with things that have happened to them. I think it's also really important to note that less than 6% of people with eating disorders are medically underweight. So this idea that we can tell that someone has an eating disorder by looking at them is really, really, really dangerous.
Wow.
If 6% of people with eating disorders are medically underweight, and that's all anyone's looking for, then we have a massive majority of people with eating disorders that are not only not going to be accurately diagnosed, but probably won't even be taken seriously by their medical providers or their friends or family. The number of times I've heard people say that they share or disclose, hey, I'm really struggling with food, or I'm struggling with body right now. And people say, you look fine. You don't look like you have an eating disorder.
Yeah.
That is so harmful. And it gets much, much, much worse than that, right? A lot of times doctors will prescribe dieting and weight loss to address health concerns. And there's a lot of misinformation, even in the medical field, and perhaps maybe most harmfully in the medical field, that health and weight have anything to do with one another. Weight is simply not an indicator of health. You can be healthy and fat. You can be unhealthy and thin. And weight loss as a prescription for health issues is actually super dangerous. Dieting doubles your risk of developing an eating disorder, and 95 to 97% of diets fail. And by that, I mean, even if someone is able to lose weight in the short term, 95 to 97% of the time, they will gain it back and more. And so you have essentially, imagine a doctor prescribing a medication that was effective 3 to 5% of the time. They never would do it, right?
Yeah.
But there's such a deep cultural bias that control is better, that thinness is better, that there's a way that we should look if we're taking care of our bodies. And we've, I think, very dangerously, with deep roots in racism and eugenics, frankly, conflated beauty and health as having anything to do with one another. And we all know the dangers of our beauty ideals and the falseness of those beauty ideals and the number of people that damages. But when you realize that that's actually killing people, it's killing one person every 52 minutes. Like, this isn't a cute issue that we can sort of dispel with, like a hashtag on Instagram. Like, this is a really big problem, and we need to get really serious about deconstructing some of the underlying beliefs and biases, because it's costing people their lives. And the last thing I will say about this is that it's kind of going to lead into our next question, which is, as long as we have this misconception about what eating disorders look like, who they affect, and what they are, and whose problem they are to solve, really, we're going to have continued kind of lack of resources available for people with eating disorders, right? If we're only serving people who fit into this tiny narrow box, which adding that all together is, probably 10% of the people with eating disorders, not coincidentally, only 10% of people with eating disorders are ever able to access care. And so these biases have affected early screening and diagnosis. They've also affected what insurance is willing to cover. And very often insurance doesn't cover eating disorder care unless you're underweight or have organ failure, or fit the stereotype that they have about what an eating disorder looks like. And this is where that piece about the fact that eating disorders are actually a mental health condition and not and treatment shouldn't depend on having a medical crisis. Not everyone with an eating disorder will experience organ failure. Do we wait until someone's in organ failure to give them therapy or a meal plan? Like, absolutely not.
Right.
There's no other mental health condition that we're waiting until someone's about to die to help them. And this is highly treatable. We have a long way to go, I think, in quality treatment for all kinds of eating disorders. The treatment that we have today is designed for a narrow population of people with eating disorders, but certainly we should be trying and not blocking people from care. And that's sort of the hill that I'm dying on here at Project Hill, is like, if someone is ready to recover and they are like, I mean, it's already hard enough to be willing to give up something that you're addicted to, or that's been a friend to you in a hard time, or that you developed out of a place of need. Once someone's ready to take that step and you have this window of willingness to heal, for their insurance to deny it or for it to cost them $250,000, it's disgusting and it's wrong. And I just can't sleep at night as long as that's true.
And that's what I heard. I heard you getting very fired up at the One Mind event because you were like, this is just ridiculous. And the thing I loved about that conversation, we were talking about demanding more of benefits and insurance to be doing more for people, and employers to be demanding more. So talk to us about, educate us around this systemic healthcare and financial barriers, et cetera, the 24 million Americans with eating disorders. And you started to talk about that, but expand on that and explain a little bit more. Help us understand what you're seeing and any hope for change.
Yes. Okay. So essentially, eating disorders take about 2 years to recover from, that currently, like with the existing treatment that we have. And that's if somebody, does the whole thing from start to finish and really finishes it, right? This is not a quick fix. This is really deeply repairing and rewiring your inner workings around something that you can't just be abstinent from. With substance use, there's the abstinence model works. Food we have to engage with multiple times a day, and it requires more nuanced healing. And if, 2 years of treatment all in can cost around $250,000, $250,000. And so unless you have platinum insurance or just a lot of money, you're probably going to receive either zero care or inadequate care. A lot of people are cycling in and out of treatment. They're being kicked out early and then they have to go again. And there's a huge problem with relapse. And it's not because this illness isn't something you can recover from. It's because it's not being adequately treated or treated to outcome. And that's just for the folks who are able to get into care. There's a huge issue with regard to government-funded insurance versus private insurance. Government-funded insurance, i.e. Medicaid, Medicare, TRICARE, are essentially only covering inpatient, which is hospitalization, or outpatient. And that's what the Federal Mental Health Parity Act requires. It requires that mental health treatment is treated equally to medical conditions. Well, medical conditions are treated at the hospital level or at the office level. There isn't any intermediary care, but we have a lot of evidence to suggest that there's a lot of intermediary care that's needed for eating disorder recovery, like residential, day treatment, intensive outpatient, group support, a lot of the dietitian services, a lot of these aspects of care take much longer than insurance companies want to pay for them. And they need kind of a group of services and bundled care and support that's encircles a person and gives them all of the support that they need and all of the tools that they need. And so as long as someone is essentially going to an outpatient therapist that may or may not specialize in eating disorders, and then waiting until they're in organ failure to go to the hospital, where, by the way, the hospital staff don't know how to treat eating disorders either, that person's bouncing in and out of the hospital, and their life is, you can imagine, not not going very well, right? And that affects their employment, and that affects their ability to have relationships, and it creates long-term health problems, many of which are really hard to recover from. It affects bone density, it affects your heart, it affects reproductive systems, it affects your dental state. And so there's just like a lot of aspects of this. And that's like, parity is just not good enough when it comes to eating disorders. And even the Federal Mental Health Parity Act is under reinforced. And so there's a lot, I think, that the Department of Labor can do to enforce that. But one of the reasons I talked about that at One Mind is that there was this audience of major employers who care about mental health. And what I think can really turn the tide is people with influence and power, especially like a large company that's paying an insurance company as the plan for their employees, has the ability to require much more than someone who is low income, who's just a plan holder. You know, that person can file as many appeals as they want and, you know, write strongly worded emails and maybe even sue. And actually, some folks are winning those lawsuits about insurance companies not covering their care adequately. But that takes years, and it's really hard. Something that can change the way that our healthcare system works in the US is having these major employers who have hundreds of thousands to millions of employees in the US demanding that their private insurance covers it in a certain way. Then we'll start to have data that shows this works and require that, and make change at the federal level for folks with government funded insurance to show them, like, this is insufficient. Here are the outcomes you're getting, right? See previously referenced death rates. And then you have this other model, which is actually more affordable for the government in the long run, if we want to talk about money. But it actually works, and it saves lives. And I think our insurance companies, whether government or private funded, are obligated to be in the life-saving business. That's the point.
Yeah, I totally agree. And I loved that conversation because you were right. You had a captive audience of people that do care, and in bigger organizations that could move the lever. And I loved that conversation because you're right. The voice of the bigger companies could actually move the needle in the right direction. Eating disorders and beyond. I mean, you take any mental health challenge and you look at the level of care that is baseline provided, and then you know what should be provided but isn't provided, and it's just horrible, and it causes people to never get cured and have to go back in and cycle through, and it's like, does that really make sense for anyone?
I know. And a big part of this is suicide rates as well. I mean, the death, the mortality rate that I mentioned is not entirely medical. It's also including death by suicide. And it's, I think, on all of us as a society to help people not get to a point where they feel so hopeless that the system is so firmly fixed against them that they don't feel that they can keep going.
Yeah.
That's in a country like this, with the quality of healthcare that we have and the money that we have, that's just unacceptable.
Absolutely.
Yeah. And I think eating disorders is a very interesting, mental health is having a moment right now. And I really hope it continues. I think the pandemic has really pushed everyone. Someone else at the One Mind conference was talking about, like, if you had, if you were like sort of mentally really solid before, the pandemic has probably moved you a little right of center towards like struggling. And if you were struggling before, then you maybe have now officially like a diagnosable mental health condition. And if you had like a serious mental illness before, like, you are absolutely beyond yourself right now. And so everyone's struggling. And I think that it's opened up the conversation. And my only hope is that that's going to continue and actually drive more resources towards it. I know there's a lot of really cool innovations in mental health care right now,
Yeah.
but it's important that eating disorders don't stay in the background because they're way more common than people realize. And right now, like this tiny percentage of people who are able to access care and recover is such a small and very quite homogenous group of people, right? The idea that eating disorder recovery is like a privilege. And if you go to like an eating disorder advocacy conference or, an eating disorder, treatment provider, like networking event, every single person there, I mean, with very few exceptions, is the thin white woman. And it's not by accident. It's because those are the folks who've had access to the resources to heal and then return to the field. The more people we heal of greater diversity, those numbers are represented in the number of people who have eating disorders, like then they can go and help their communities and they can go be represented to their communities. Like less than 5% of eating disorder providers are BIPOC or trans or men. When you compare that to the number of people who have eating disorders, you're essentially like, there's a huge shortage, I think, like of appropriate, identity affirming providers who can like understand your experience. And the narrowness of the field, I think, is really harmful. Whenever I speak with people, particularly like in communities of color, they're just like, we never talk about this in my, in my communities with my family or with my friends. It's even more like just not even on the radar. And I think white communities, it's like, we all know someone, but we don't talk about it.
No.
In Black and brown communities, they're like, it never occurred to me. Like this seemed like a white girl problem, and it's not. And that's devastating that there's not even like the question isn't even being asked in those communities. And I just think about how amazing it would be to help more people from marginalized communities heal, become healers, and then start to those conversations within their own communities. Nobody really wants an outsider to come into their community and be like, you all have this diagnosis. Coming from one of your own who understands maybe the unique issues with like the way food is handled in your culture, what happens in food deserts that's unique. Like, what are some of the ways in which the other forms of systemic harm are rippling out into our relationships with food and body? What I know for sure is that it is.
Yeah.
What we don't have enough of is actual research and data to support that. And then people who, there are some amazing people talking about this, but there just aren't enough, right? And it has everything to do with access, which is why Project Heal is so focused on that.
I love that. It's so awesome. I can't not address this one question, and it's not in our slate of questions.
That's
so
okay.
It's a bit of a curveball, and I hope you're okay with that. But like, I have to ask you your thoughts about this whole recent whistleblower for Facebook talking about talking about the influence that this is having on body image and Instagram. Like, what are your thoughts on that? I mean, you have to have thoughts on it, I'm sure.
It's wild that you asked me that. Sorry. I sent an email an hour ago to like 12 people at Facebook that I actually had a meeting with earlier this year to talk about community safety guidelines around eating disorders at Facebook and Instagram. So I actually have their email addresses, and I was like, hey, I think that I don't want to say anything necessarily about culpability and responsibility. I think that, I don't know enough. I didn't listen to all of the testimony. The people who I've talked with certainly seem to have good intentions. And I think that, the online world is new territory for all of us. And we're learning a lot of the ways in which it can be both leveraged for good and leveraged for harm. And obviously it causes harm. I could think of it, 100 stories off the top of my head that substantiate the harm that was described by the whistleblower. And what my only hope is now is that, Facebook, with all of its money and brilliant minds and resources, takes it seriously and implements, meaningful policy changes that are informed by clinicians and people with lived experience. And, takes its responsibility to protect its users seriously.
Mhm.
They have a lot of power and they can use it. And I think that's my hope, is that I'm not necessarily, I don't think it's realistic to cancel Facebook or Instagram. Like it's just not going to happen. We've saw what happened with the election and all of the
Yeah.
political discourse. Like if anyone has watched The Social Dilemma, like we know that this is a beast that is hard to tame. But it's really not that hard to make sure that you're not damaging the mental health of your young users. It's just not.
Yeah.
It's very doable. And it's their responsibility to do that. And so my email was offering Project Heal's help to do that. That's part of what Project Heal does. We obviously do have those direct service programs, but we're also trying to create systemic change at the individual level, at the cultural level, and at the policy level. And honestly, my goal is in 20 years, we won't be needed anymore. Like I would like maybe even 10, but I mean, I want, universal healthcare. I want people broadly across cultures to be able to recognize an eating disorder when it shows up, because it will sometimes. And I
Mhm.
want them to be able to easily access the care that they need without going into crippling debt and have a shot at recovery. And I want that to be like a very standard experience that we all know what to do. And when that happens, Project Heal's mission will be accomplished. And that feels doable. We're not trying to like say no one can ever have an eating disorder again. Eating disorders have existed as long as people have been alive. This is not a modern invention. We just have language for it now.
Yeah.
Um, People play out their issues with food, and trauma and anxiety and depression are showing up in our body. Like our emotions, our mind and our body connection is very complicated. And so eating disorders are a natural outflowing of what it means to have kind of distress around such a core issue. So I think we can reduce the rate of eating disorders by changing the culture. Like we could do a lot better to not have a culture that's like just a festering petri dish ready for anyone with a predisposition to eating disorders to develop one. But we can also make it something that doesn't take any lives, that people can easily access the care that they need. That's
Amazing.
my goal.
Yeah, I applaud that vision. I really do, and I think it's possible too.
I do too.
What are you guys up to next? How do people get involved with you? What are you up to next? Who should reach out to you?
Yeah, I mean, if you are struggling with accessing eating disorder treatment, please come to our website and apply for support. We'd be happy to do everything that we can to help. We are launching a clinical assessment program next year that's going to basically eliminate the barrier to diagnosis. And so that'll be a free offering and help people figure out where to start, what kind of treatment they might need, what their insurance might cover. We're going to be doing a lot of expansion in the coming years. So if anyone's watching this and is inspired to help, $5 or, a $250,000 grant from a corporation, anywhere in between, like we need all the help that we can. Eating disorders are a really underfunded part of mental health care. All eating disorder nonprofits together raise $10 million annually, which is nothing
Nothing.
compared to, all of the other diagnoses, which are raising hundreds of millions, if not billions of dollars for the services that they need. So, if you can spare any of your time or financial resources to help, that would be amazing. If you have a story to tell about your own recovery, we would love to feature you on our blog. So all of this is available at our website, www.theprojectheal.org. It's in the little banner here.
Thank you. And then one last thought. How do we help someone if we sense that they're struggling with an eating disorder?
Yeah, I think that my go-to answer for this is to understand the nature of your relationship. I think that saying something requires a certain amount of intimacy. So I wouldn't walk up to someone on the street and say something, especially because we just got done talking about how you can't really tell if someone's struggling by their appearance.
Yep.
But if you're observing someone's behaviors consistently, right? If there's a pattern of behaviors and a change that you're noticing because you're close to someone, I think it's important to say something and to keep it observational. and to keep it open. If you come at someone and say, I think you're struggling with an eating disorder, they'll understandably be very unhappy with that. But I will say people with eating disorders ultimately are grateful for and want to be seen. I've heard many times from people like, how did no one say anything, right? Like they both don't want to hear it and they desperately do want to be seen. And so it's a real catch-22. Know that you're going to be poking the bear, so to speak. This is not an illness that, goes quietly into the night. It's very, very tricky and can be pretty aggressive. But if you lovingly and calmly sort of say like, hey, I've noticed that you haven't been coming to dinners regularly, or I noticed that you leave the table after dinner, and you're like genuinely just describing a behavior you've noticed, then and say like, maybe you're not ready to talk about this, but when you are, I'm here, and let them kind of come back to you when they're ready, rather than demanding, a conversation at that time. Like they need to consent and sort of be prepared for that conversation. But ultimately, as uncomfortable as direct feedback can be, we all love to avoid conflict. Ultimately, like that will be a life-changing moment where you really showed someone love. And so be brave, and tread carefully.
Rebecca, thank you so much for being here.
Thank you.
I mean, like your passion comes through, your drive to cause change is so admirable. And I just so appreciate you spending this time with us to help us understand and educate us. And thank you for your time.
Thank you for having me, and thanks for including eating disorders in your important conversations.
Awesome. Thank you so much. And I'm sure we will stay in touch. Have a great rest of your day.
Thank you. You too.
Bye.
Bye.